High blood pressure is the leading cause of strokes, and with May being Stroke Awareness Month and National High Blood Pressure Education Month, that is why we're talking about it. So today, Dr. Palik with Triad Neuro Hospital's Cone Health is here to talk about blood pressure and strokes, including the steps that all of us can take to reduce our risk and the warning signs as well. Okay, so first up, let's just talk about what is high blood pressure or hypertension.
Yes, so thank you for bringing this topic up. It's very important. And high blood pressure is where the pressure is above a certain number. Usually we like to have about 120 over 80, and that's where our body likes it. And anything higher than that is considered high blood pressure, and there's different stages depending on how high that number is. But it's kind of like, pressure in a garden hose, sort of water pressure in a garden hose that's been left on too long. That pressure can build up, wear and tear over time, can weaken that hose and spring a leak. And so that's something that can be dangerous for the body.
All right, we don't want that. So let's level the playing field. Who is at risk for this?
So, as we age, our risk increases, typically people greater than age 55. But there's a lot of things that we do that increases our risk. And these are things that are modifiable: obesity, smoking, things like that can do that, having a sedentary lifestyle, and even excessive alcohol use.
All right, now if you fall within one of those categories, one of those risk categories that you just mentioned, what should you be doing right now?
You should definitely have a primary care doctor. Go see your doctor. That's that's the first step and the most important thing you can do. You have to have someone that's checking your blood pressure, monitoring it closely. Oftentimes you don't know you have high blood pressure, and that's the reason to at least see your doctor, once a year, have an annual visit. The so-called physical, and that's very important to have that to detect high blood pressure.
That's right, because they're taking your blood pressure every single time you go for that annual. So maybe let's talk about some of the symptoms that would indicate that we may have high blood pressure, so that you can get people thinking, oh, yeah, that does happen to me.
That's correct. And high blood pressure is called a silent killer for a reason. Oftentimes there are no symptoms, and that is what's really scary. You never know you have it until it gets really high or becomes problematic. Oftentimes the symptoms are very vague. It might be just that you're tired all the time. You might have dizziness, headaches, things like that.
Okay, so we should then get checked for high blood pressure, and you say at least once a year.
That's right. At least once a year is reasonable, and as the risk factors add up, maybe more often. But if you have no symptoms, at least once a year, because you never know when that starts to develop.
All right, and so if someone doesn't have a primary care provider, and we've seen a lot of this after 2020, right? People fell off from going to the doctor or that kind of thing. So if you don't have your primary care provider, what should you do?
You should definitely find one now. So you can go to conehealth.com/appointments and get an appointment with a primary care doctor. And there are options out there, but you have to get seen. And if there are some concerning signs, you could always go to an urgent care or emergency room as well.
All right, and so what steps can people take to maintain a healthy blood pressure?
So things you can do are, modifiable. Most of the risk factors for high blood pressure, all of them except for one, age, is modifiable. So things like eating a healthy diet, which is very important, low in fats, high in fruits and vegetables. Also exercising 30 minutes a day for most days out of the week, and lowering your salt intake. These things really improve blood pressure. And oftentimes each one of these things, either lowering your diet or exercising, they can lower your blood pressure by 5 to 10 points. So it's very modifiable.
All right, that low sodium diet, that's a rough one. That salt is sneaky. It's in all kinds of things, isn't it?
It is, and that's very tough. And that's why I think people have such a hard time, because there's a lot of salt in our foods. If you're going out to eat at restaurants, it's usually loaded with salt. So, a good option would be not to add extra salt on top of that with a salt shaker. So put that salt shaker away. That would be helpful. But things like canned foods have a lot of salt in it, and people don't realize that. And the tricky thing is sometimes things that are sweet have a lot of salt in it. So all the sodas, Coke and Pepsi that we drink have a good bit of salt, even though they're sweet drinks.
All right, and usually we're worried about the sugar. All right, so we're going to take a quick break and we will be right back talking more about high blood pressure and hypertension.